In terms of masturbation, you've done a lot of work on this. What are some of the health benefits of masturbation? I mean, there's some people who accept it widely, and there's some people who think masturbation is just horrible, should never be done. But there are some health benefits. So let's review some of those.
Yeah, so masturbation can be healthy for us in many ways. And if you look at the most common reasons people report for masturbating, one of the biggest ones is stress and tension relief, right? So just as a form of self-care for, dealing with or relieving stress in your life, that can be one benefit. We also see in the work that masturbation, particularly to the point of orgasm, can also help people sleep. They fall asleep faster and they get better quality sleep when they masturbate before bed, right? And sleep is so important, so vital to overall health and function. So that's another benefit. There's also some work finding that men who ejaculate more frequently through both sex and masturbation have a lower risk of prostate cancer. It's not cause and effect, but there is that association there. So maybe it has some potential health benefits in that way. There's also some work finding that masturbation is linked to higher self-esteem in women. And I think that can be explained in part by masturbation helping you to better understand your own body and what it is that brings you pleasure. And that can make you more sexually confident as an individual. And then there's also some new research that we conducted at the Kinsey Institute this year in conjunction with the sexual wellness brand Womanizer, where we looked at the role of masturbation in menopause symptom relief. And what we found was that in a sample of menopausal women, that masturbation was reported as one of the most effective techniques for reducing a wide range of menopause symptoms. And it makes sense because masturbation can help you to sleep better, right? And so that might help in dealing with certain menopausal symptoms. But also, it was linked to women reporting less vaginal atrophy as well. So there's also some data and other research finding that women who masturbate more, who are in menopause, show less vaginal atrophy over time. And so there can be lots of potential health benefits there across the lifespan in terms of engaging in masturbation.
There was a lot of blowback from that article. And I think that the important take home is there could be benefits. We're not saying you shouldn't get treatment for menopause in terms of hormone therapy, but absolutely, if you enjoy masturbation, it could be a good tool to help you sleep better, get more blood flow to the region, and help overall in a multitude of ways. And I think that's the key with masturbation or self-pleasure in general, is that it could be used for a lot of disease conditions, right? To help with pain, to help with a lot of different things. But people tend to get very fixated on the morality of masturbation and also how difficult it is to get funding. I mean, you guys are obviously very good at that, but it is very difficult to get funding to say, hey, I want to test if masturbation helps, PCOS or whatever the condition is.
You're not going to get government funding to do a study like that. But when it comes to, masturbation and its health benefits, it can be used in conjunction with lots of other things in your life. We're not saying that masturbation is the only strategy you should use for improving your health. But if you're talking about menopausal women, you can use masturbation in conjunction with hormone therapy. It's not an either or phenomenon. I just think it's a useful tool that we can use as a form of self-care that might also have some health benefits. And I realize masturbation may not be something that everybody is open to doing. And there are various reasons why people might not be open to it. And also for some people, masturbation might not be as accessible. As you get older, sometimes chronic health issues, disabilities can make it harder to engage in masturbation. Certain sex toys can become harder to operate and things like that. So yeah, there can certainly be challenges sometimes in terms of accessing the potential benefits of self-pleasure.
Yeah, there is, however, sex furniture that you can get that can help you, particularly if you're older. I've made a video on this. I think it's sex after 60. But basically, you can buy certain things to help you get certain positions, be able to even, we actually have things for catheterizing. So when women catheterize to open up the labia, so you could use those. There's a whole host of things that you can do to help yourself if you want to, right? And I think that's just for people who may be curious that, if you can't get certain positions because you have arthritis or it's difficult or holding yourself up or whatever, whatever position you normally do is no longer attainable to you, there are ways to help yourself with that.
And, that's one of the keys to maintaining a satisfying sex life throughout your entire life is to get a little bit creative and to try some new things. And sometimes the answer is buying sex furniture. The single most common complaint that seniors report when it comes to sex is that the old ways don't work anymore. Mm-hmm. And so you need to find new ways because your body changes. What feels pleasurable to you changes. What you desire, what you fantasize about might change as well. And so having an ability and openness to explore is really important, but also expanding your definition of sex. Like sex isn't just one thing. It's not just penetration. Mm-hmm. And the older adults who are the most satisfied with their sex lives have the most expansive definition of sex. They see sex as intimacy as opposed to sex as penetration.
Yeah. And apparently in the nursing homes, there's a lot of sex.
And a lot of STIs.
Yeah. Still use a condom or dental dam or something. But yeah, absolutely. So you gotta figure out new ways, new tricks. So what are you working on right now that you're excited about?
Oh boy. Well, I have a paper I'm working on right now that I think is really interesting. It's about people's openness to dating and having sex with people who belong to different political parties than they do. And I think it's an important topic given that we live in this highly politically polarized time, right? How is this impacting the world of sex and dating? And one of the interesting things I see in that research is that men, regardless of their political background, are much more open to the idea of sex and dating with somebody who belongs to a different political party. By contrast, women are much less open to it.
Really?
And I think a big part of the explanation for that is that politics is more personal to women in a lot of ways, especially when you talk about things like the Me Too movement and growing restrictions on women's reproductive rights and freedoms. And so, politically, being with somebody who is different from you, many women perceive that as a threat to women's rights. And so it's something that can provoke fear or anxiety or safety concerns. By contrast, for men, many of them seem to find something uniquely arousing about the idea of being with somebody of a different party. There are some guys who actually even hire professional dominatrixes to engage in kinky political role play, right?
Wow.
There's something going on there.
Yeah, that's interesting. It's maybe like a challenge to who you are or something that you find you're taking on or you're conquering almost.
And I think there's also a taboo element to, dating somebody who belongs to a different party, and men are more turned on by taboos. So I think there's some element to that that's going on here as well.
Interesting. So we end our podcast with some questions I ask everybody. What's something you know now that you wish you knew earlier?
Well, I think a good one would be don't delay pleasure, right? Because sometimes we put off doing the things that we really want to do and that would bring us pleasure because we feel like we have all these other things on our to-do list that we have to do first. And when you start getting into that mindset and you keep delaying pleasure, unfortunately, sometimes it turns out that it's too late for you to experience that. I've seen that happen to too many people in my own life where they had all these dreams and hopes and things that they wanted to do with their life. They delayed, and then a health condition or something else struck, and then that suddenly they'll never be able to do those things that they wanted to do. So don't delay pleasure.
Life is short, and that does not mean just sexual pleasure, any pleasure of any kind. Yeah. So taking that vacation or doing that class you wanted to take to learn, XYZ knitting or jujitsu or dance or whatever, do it because work's always going to be there.
Work is not going anywhere.
Do you have a non-negotiable, something you do every single day?
This is new this year, but it's to go to the gym almost every day. So I've been going about 6 days a week. Sometimes I do actually go all 7. And I have to remind myself that I need to take rest days from it. But I found that it is very good for just my mental health and well-being. It gets me out of the house, gets me physically active, and just not thinking about work for a while. So it's become an important part of my own self-care routine.
Yeah, I love going to the gym. It's like a little escape from everything. Mm-hmm. Just focus on what you're doing and do it.
And sometimes it's easier to, do those things that you have to do if you just take a break and go to the gym first, because it provides this reset, right? That I think is really helpful.
Yeah, you can only be productive for so long.
Mm-hmm.
Do you have a health hack outside of going to the gym or life hack that you want to share?
One of the most important things that I've learned is to say no. We get asked to do lots of different things in our lives, and sometimes too much is asked of us. And lots of us want to please other people, right? We were trained to be people pleasers, and then we end up overcommitting, and we're not happy. That's bad for our life, our mental health, and so forth. And so learning to say no and to set boundaries is something that it's hard to do, but it's an invaluable skill. And I do say no to at least something every day because I just have to for the sake of my own health and well-being.
Absolutely. I mean, no is a complete sentence.
It is.
And it means that you can say yes to the things that really matter. So I think that's a great one. If you couldn't be a psychologist, sex researcher, author, what would you do with your life?
So my very first job when I was in high school was I was hired as a teen film critic for our local newspaper in Canton, Ohio.
That sounds really fun.
And so getting paid to go see movies and then write snarky reviews about them was a lot of fun. So if I couldn't do any of the things that I'm doing now, maybe I'd go back to being a film critic because that was a lot of fun.
That does sound really fun. Where can people find you?
My website is sexandpsychology.com. That's where you can find my blog and podcast. The podcast is also available anywhere you listen to podcasts. And my books are Tell Me What You Want and The Psychology of Human Sexuality. And you can follow me on the socials at Justin Lehmiller or Justin J. Lehmiller, depending on the platform.
Awesome. Well, thank you so much.
Thanks for having me.
And if you liked that clip of the Rena Malik MD podcast with Dr. Justin Lehmiller, make sure you check out the full episode right here.